I guess I'd just start off by saying, we're finishing 2 years, and I think we've done the things that we said we'd do when we came, and we focused on those things. We said we'd focus on getting the budget right for Tennessee. We've had 2 budgets that have been basically flat or down from where they were before. We've cut taxes, hall income tax, the gift tax, eliminating the estate tax, cutting the food tax. We've improved the state's financial standing, which was already good, but we've kept it there, and I think maybe improved it as well. We've addressed major issues around education with a 10-year reform bill, with a new evaluation procedure, with a charter reform bill our first year. And then on business, as I said, our primary focus was going to be on improving the economic climate. We had a major piece of legislation last year around tort reform. But more than that, I think what you've seen is a focus in terms of how we spend our time, out actively recruiting and working with businesses, and then how we spend our time trying to make sure government works better every day. I know the focus easily is on what's the legislation you're going to do, but at the end of the day, I think where we make the biggest difference is making certain every department runs better. It's why we had the civil service legislation last year, because whenever there are an issue, some people say, well, gosh, why did that happen? And I think the answer often lies in, do we have the very best people we can, and are we paying them at market rates? And so last year, civil service reform was about that. How do we make certain we can go recruit the very best people? And then now we're doing an overall compensation study to look at not just salary, but benefits as well, to say, are we competitive in the market out there? If we have positions where we're losing people frequently, is there a reason? And usually there is. It's because if we can't hang on to that engineer because he or she can make more somewhere else. And ultimately, if we're not market competitive, then we're going to have issues in our department. So it's about getting the best people and making sure we're competitive on salaries. So that's my whole
that's
intro.
Can you talk about the budget a little bit?
Oh yeah, thank you. Okay, thanks. I will say this kind of anticipation of next year. I actually think this year's budget will be our most difficult yet for this reason. As everybody knows, our revenues were better this past year than what were expected. And so when that happens, everybody lines up saying, well, finally, we've had a tough environment for several years. Finally, it's my chance to get what I've been wanting, and that's both internal groups, by the way, departments, and external groups. The difficulty for us this year is TennCare is going to take up the majority of the new revenue that comes in. And that's 2 things. One, it's just a natural increase in TennCare that comes from cost increases for medical care for our existing population. And then the Affordable Care Act, new health care plan, Obamacare, whatever you want to call it, is going to take a significant dent out of our new revenue as well. So, the vast majority of new revenue will be taken by TennCare. We're going to have to address some issues with corrections. Our number in that are incarcerated has gone up, and that's going to be a hit on the budget. K-12, as you know, we've tried to keep the funding there. We'll eat up another big piece, and that's before we do anything else, from give salary increases to pay our own health insurance increases, et cetera. So I say it'll be a difficult year because I think expectations are different. When we came in 2 years ago, everybody knew times were tight, federal stimulus plan money was going away, they're going to have to react to it. I think now there's a sense of, hey, things are a whole lot better. Now it's finally my chance to get something. So our requests are, while always deep, are a lot deeper than they've been before. And I think what people have maybe underestimated is the impact of TennCare cost increases on the state.
What is the figure that you have played with that you'll have?
Yeah.
Are you calling it $500 million? Are you calling it?
Really good question. It's really good. And ultimately, the funding board is meeting, I think maybe as we speak, y'all might know, but this afternoon sometime. And ultimately, they make the call about what the increase is. We really will have, there'll be 2 numbers in there. One will be the projected, and remember now we're talking about the fiscal year that will end a year and a half from now, so that will start next July 1 and go to July or June 30, 2014, which seems like forever away. So it's what are we projecting for increased revenue for that period? And that'll be a number somewhere in the 300 millions. I don't know where, 300 to 400, okay, somewhere in that number. And then you have what this year will be more than projected. And that, I don't know, again, exactly what that number will be, but a number in the 200s. Okay, I'm giving you a broad range just because I don't know. So
at least it's not called a shortfall.
no, it's not. It's not. That's exactly right. So, but that's new revenue. Now, of that new revenue, more than 300 plus of it will go to TennCare. So, but like I said, before you do anything, K-12, just the BP funding, not 2.0, but just fully funding existing BP takes, I don't know, but it takes close to another 100, okay? Don't quote me exactly on that, but just for ballpark numbers. Corrections will be a big number as well, you know, somewhere north of 60 or 70 million in terms of increase. That's before we get to things like trying to make certain we're adjusting pay for people at DCS to make sure people that in the intake process we're hiring the best people we can. That's before we look at giving basically a raise. Every 1% raise for if you give state employees a 1% raise, it's roughly $50 million total, and that's again not exactly, but it's a good rule of thumb. So that's before you do that. That's before we pay our own health insurance costs, which will go up about $50 million. So you see where I'm going. It's that while it's not a shortfall compared to say 5 years ago. That money gets eaten up pretty quick before you start to do some of the things that you would like to do.
You had mentioned earlier in the year that the days of funding of cutting education for higher education, cutting higher education funding. Right. I mean, given what you're saying, I thought, do you anticipate possibly increasing higher education funding?
Yeah, that's a really good question. Again, we literally are meeting every morning these 2 or 3 week periods here before Christmas trying to figure out exactly where we end up. It's still our fervent hope not to cut higher ed funding. The issue really comes down to, as I said before, higher ed's been cut over the last 30 years because Medicaid / TennCare took a bigger piece of the budget, and that is still what we're fighting now, but it is like I said, we can't keep cutting higher ed if we want to have a bigger percentage of our population have degrees. It's really simple, and we're trying to figure out a way to do that.
Getting back to TennCare.
Sure.
And I've been looking at this a little bit, the whole expansion question. I know you haven't made a decision. But if you expanded Medicaid, how would that affect that TennCare number? Really, really good question. So it's the same thing. Some of our increased TennCare costs is because of the new health care plan. A lot of what I hate to get in the weeds here, but eligible but not enrolled. People who are currently eligible for TennCare but are not enrolled for some reason. That number, again, I don't know exactly, but close to $100 million type number. The reason that's so expensive is those are people that we pay the old match rate. Federal government pays 2/3 and we pay 1/3. The expanded population, they pay 90%, we pay 10%. So we don't know exactly what that would be, but over a 6-year period, it's probably fair to say that would be over 6 years. Okay, you got to take that. It'd be about 900 to $1 million to $1 billion over 6 years. Now it's backloaded because the early years, the first 2 years they pay 100% of the cost, and as it goes on, it goes down.
For the expanded population.
Exactly. On just you really have two kinds of folks covered. Obviously, everybody's the same, but people that were eligible before, we pay 1/3, they pay 2/3. People who are eligible under expansion, if you expand, and we pay 10 and they pay 90. We haven't made the final call yet there, and probably won't for several months.
So, I'm sorry, the $900 million to $1 billion, that is the
total. If we decide to expand, if we decide to expand, and let me emphasize, that's an estimate, okay, but if we decide to expand, that's the cost over a 6-year period.
To the state of Tennessee.
Yes. Now, that's not the total cost of the health care plan,
Right.
because you got the eligible but not enrolled. Then we also, as a Medicare, as a health care provider ourselves, like, we pay a $50 million tax, for instance, as part of this plan. There's a lot of other things like that, but that's just the expansion piece of the equation. Is
Now,
that?
how much did-
offset by anything else?
No, not to us. It's not. Not to us. There's no gains that we get because of that. I mean, you get more people are covered. I mean, so bottom line that is. But those are people that the state's currently not paying anything on now. The hospitals are receiving some funds for them.
Well, that.
Well, maybe go to Kara. She's been, and I'll come back.
And that's it's kind of, when it comes to making that decision, already the hospitals,
Right.
if there's not an expansion of Medicaid, I mean, they're projecting losses of, $1
And
billion.
we've actually asked, so maybe the next question to ask was, when are you going to make the decision? One of the things we want to do, again, is to make a thoughtful decision about the impacts. And one of the things we said to hospitals is, we understand that. Show us exactly what that would look like in numbers. What would you lose in what's called disproportionate share payments? So right now, if somebody walks into the hospital and they don't have TennCare, the hospital takes care of them, they get reimbursed to a degree for that uninsured person, not what they would if they were covered with TennCare. So, but under the health care plan, that disproportionate share payment goes away to the hospitals. So we've asked them, start to show us what that would look like in numbers. What do you gain if that person's covered? What are you losing now under the new plan?
And the hospitals will argue that, I mean, they've during this cuts time, I mean, they did step up to the plate, when they stepped up to the plate with the coverage and assessment.
The fee, right. And so, again, that was in lieu of taking a lot more cuts to Medicaid TennCare if the fee hadn't been existed, which, like I said, worked for us because we got to keep providing that coverage, and worked for them because they kept getting paid for it. So they have, and there's a valid argument. The argument on there, some people say, well, it sounds like a no-brainer. They're going to pay 90% of the cost. Hospitals are going to be in a really bad position if they don't. Sounds like a no-brainer. Well, the problem is, as you see, our budget is slowly getting eaten up by TennCare. And if you remember back to, some of you are here back when Governor Bredesen cut the rolls of people covered. Prior to cutting the rolls, TennCare was about 1/3 of the budget, about 33%. He did everything he could to reform the program, couldn't, so he just had to cut the rolls. That process took it down to being about 24% of the budget. So sorry to get all numbers nerdy on you, but it does kind of show where we're going. We've already crept back up to where it's 26 or 27% of the budget now. When you do that, things get squeezed out. So even though you say, well, gosh, it sounds like a no-brainer, they're going to pay 90%, you're only going to pay 10%, that sounds like a great return on your dollars. Well, it is, but still paying that 10% means something. That $1 billion, $900 million to $1 billion over 6 years, it's got to come from somewhere. So is it going to come from higher ed? Is it going to come from K-12? Is it,
But just to button this up on the expansion of the Medicaid decision, you plan to make that before you present?
I probably won't for this reason. No, I probably won't. Our budget won't be impacted the first year because they pay 100% of the cost. To receive the federal funds, we would still have to have that approved by the legislature. It still would have to be part of it still would have to come in and out of the budget. It wouldn't be any of our money. It'd still have to come in and out. So the reason we won't is this. I think there's still a lot to learn. For instance, CMS, who runs Medicaid, has said, we think in this new population, we'll give you some flexibility on the coverage. In other words, we'll let you have incentives for healthy behavior. We'll let you have a copay that means something. Right now, for TennCare, there's a $3 copay, but you can't force anybody to pay it. They've intimated that for that expanded, the less poor part of that population you're expanding to, that they might, again, do some of the things that other health care plans do to control costs. They've indicated that. We don't know that.